I can go here and not have a terrible experience where I'm on the phone for hours calling 5 different parties to try and resolve my issue. We need to solve for all of that so that it's more rewarding, more enjoyable, because that's where the cost savings will come in. That's where the innovation will come.
Welcome to Self-Funded with Spencer, sponsored by Pareto Health, ClaimDoc, and PlanSight. Whether we're discussing innovative new healthcare strategies, exposing hidden revenue streams or misaligned incentives, or even just cheering on the next generation of this industry, we promise you that you're going to learn something. So thank you for joining us for another great conversation about the future of healthcare. Who are you? Why don't you just say real quick? We skipped over that part.
So I'm Ben Callaghan. I am the VP of launch at a company called GoodRoot, and also the Chief Experience Officer at our newest venture, Empara.
Chief Experience Officer. So why the experience? Because that's a new one for me. What does that mean?
Yeah, so you just mentioned it, right? So who's taking responsibility for the experience that sort of end users of healthcare are having? I think healthcare is way behind in that and in its technology that enables those experiences compared to what we're used to from, I would say, other consumer entertainment and retail, for example. Yeah. And there's a lot of reasons for that, but I think there's a lot of opportunity now as well. So really focused on what technologies, solutions, and services can we surround members with to enhance their experience and deliver kind of a consumer grade level quality.
So like when I think about that kind of title or that nomenclature, you got your CEO, you got your CFO, your COO, you kind of know what they do. The Chief Experience Officer kind of categorically is new. Where do you kind of liaise between, or like do you overlap on some of those other C-suite titles or responsibilities?
Totally. I mean, it is, I would say, a bit of a crossover role because you're looking at design, you're looking at marketing and communication, so clarity of message, of solutions. When it comes down to it, it's technology based a lot, right? What are we building that makes things more seamless, more easy, delivering a lot of value, and then in the end, there's a service level component to it as well. Yeah. What are the standards and the definition of the experience that we want people to have? And are we delivering on that?
Yeah, we'll go back to that because I want to see how you track that, like what data points we use. But I would love, Ben, for a second, let's kind of go in your background. We're going to cover GoodRoot and specifically under the umbrella Empara, and then I'm sure that the conversation will navigate between other business units as well. But you're relatively new to healthcare. Didn't start here. I want to go back in time a little bit and get a sense of kind of where you grew up, education, what you wanted to do in life before you found yourself in healthcare, all that good stuff. So give us your bio, man.
All right. So grew up in upstate New York, in the Adirondacks up there. Grew up outdoors, just loving it. Fishing, hiking, camping. And I always appreciated kind of the opportunities I had there and always loved as I thought about what I was going to do. I was terrible at math, couldn't spell, still can't. Had a lot of kind of troubles with some of those other areas. Loved kind of art and design. So that's where I ended up going at the design school, sort of in the branding.
What school did you go to?
Alfred University.
Okay. And was that specifically a good design program?
Definitely. Okay. Huge art program and good design school. I had lucked out and had a phenomenal professor that just kind of painted a picture of what was possible with his career. And I eventually realized, design was more of a kind of a way of thinking, a way of being for me, whether I'm cooking or designing out the greenhouse I'm going to build at my house or I'm doing my bathroom renovation.
Yeah, you tell me
now.
Design, it kind of permeates everything that you do.
I'm speccing stuff out in like Illustrator, but to scale, right? And like mocking things up so that I can show my wife what it's going to look like, that kind of stuff. So, and then I apply that beyond, one of the dreams I had as a kid, we skied a lot, was to have my own ski company. So out of school, started a ski design and manufacturing company with my buddy who was a mechanical engineer, and really took that pretty far. We both got real jobs. I was working at a brand shop in Hartford, a kind of a boutique consultancy there, and ended up, launching. We were doing some really cool stuff with high-end carbon fiber manufacturing. We made all the tooling. We did everything ourselves. We were sourcing materials from Europe, and ended up.
Were you moonlighting this after hours?
Yeah, moonlighting, 2 a.m. kind of thing.
Okay.
And ended up getting free, editor's pick in Free Skier magazine for one of our powder skis. So it was really fun. In the end, we kind of decided to have families rather than be ski bums. But
yeah, you said the reality, even though you produced a couple hundred pairs of skis and they were kind of higher end and pretty dynamic and awesome.
Yep.
Like, did you struggle to find the market?
Yeah,
it
was good learning. I mean, it was learning from what you can do with how much you can do with how little, and sort of a further exercise in imagining a possibility for a product to enhance a real life experience, and then seeing that through to the point of being very real in the world, and that was very exciting.
What was the main lesson though?
Lesson for sure. I mean, was don't build a product for a market that doesn't exist.
That's a valuable lesson.
It's sort of 101, but
it exists for you because you said you still have those skis.
We still have them. We still ski them all the time. It's the only thing else probably.
Does anybody ever stop you and go, "Those are sick skis, dude"?
Definitely, definitely. Yeah. They're like, "Hey, what's that brand?" I'm like, "Oh, you won't find them. Yeah, you won't find it anywhere.
These are exclusive."
That's right.
That's cool, man. So you sunset that business, and then you were in a consulting firm, right? So what were you consulting around at that time?
Yeah. So I was I think I was at the same place for about 14 years, and it really evolved. So it started as more of a branding and marketing shop, and then the deeper we got into kind of figuring out the story that people wanted to tell about themselves and what their identity was, the more we found out that a lot of companies were struggling with that question.
Yeah.
So we dove in deeper and really evolved to become kind of a boutique business consultancy. We called it Future Design. Essentially, it was in the category of strategic planning, but it was beyond that. It was making purpose-driven organizations and helping people imagine in business, right? Mm-hmm. Imagine in creativity. There's a big lacking of that in the business world sometimes. We were in architecture, engineering, manufacturing space was big for us. Some nonprofits and other things as well. So we would work with executive leadership teams, help them reimagine who they wanted to become in 3 to 5 years or 10 years, get a really audacious goal, work backwards from that with OKRs and goal setting, and then really prepare leadership for change. And also involve the entire organization and community around these conversations so that they could also prepare and engage in change.
Well, you're preparing for the change, right? Because if you want to get with this big, hairy, audacious goal and you want to get to it in 5 years, there's going to be some discomfort, right?
Absolutely.
There's going to be some massive changes that probably have to be undertaken in order to achieve that. If there weren't, then the goal's probably not big enough, right? So like that change management, that's probably a lot of behavioral psychology that you're dealing with, the human beings and resistance to change and all that stuff, right?
Yeah. I mean, a lot of reflection, a lot of identity seeking for people.
Yeah.
We would go through visual identity exercises. In the end, what I was witnessing is that it was a practice of self-identity, right? The leaders were struggling with who they were, who they thought they could be, and then that just expands when you're thinking about a whole organization. But so it was really fun work, a lot of great learning. Got to see a lot of different types of businesses and how they work, how they operate, the challenges that the leaders.
Well, that's a real world or street MBA, right? Because you're helping these other businesses that are in operations today, and it's project-based work, correct? Right?
Yeah.
So there's a timeline.
Yep.
And then how often were you bouncing around between other businesses? Is it one at a time, or is there multiple?
We had some relationships that were 10, 12 years. So we would stay with them. So, some were shorter, so some were more engagement based, but most of our clients, once we engage with them, they stayed on, or at a minimum would come back sort of annually for a refresh.
Okay.
So a lot of learning there, but that ultimately is how I ended up at Good.
Yeah, were you doing any healthcare stuff at that time?
A little bit. A little bit. We worked with a big company called Covidien.
I've heard of it.
We helped with them early on. They were they sort of had a couple different brands early on and ended up sort of going with Covidien and leaning in.
Pareto Health is the manager of the largest employee benefits group captive in the United States. And it's also now the main sponsor of the Self-Funded with Spencer podcast. I chose to partner with Pareto Health for three main reasons. Number one, their dedication to improving the world of health benefits. Number two, their mission to reduce volatility and to make self-funding simple for mid-sized employers. And number three, the strength and scale of their program. With over 2,300 member groups and more than $1 billion of stop-loss premium under management, Pareto Health is the most robust solution of its kind in the country, period. Stay tuned for more information because I'm sure I'll be featuring them on an episode of the podcast very soon. Visit Pareto Health at paretohealth.com or follow them on LinkedIn to stay up to date on the latest news and developments. Well, how did you eventually then find yourself here today, though?
Yeah. So during that process, we started working with a company called Remedy One. Mike Waterbury was the founder of Remedy One and was very impressed with their leadership team. They were doing a lot in pharmacy, some rebate stuff, and they had bigger aspirations and kind of uncovered the fact that they wanted to do more to create more positive change in healthcare and be disruptors in the best sense of the word. And that led to the concept of GoodRoot. So I was lucky enough to kind of be involved on the outside as a consultant, see that process. As a consultant role for me, I helped create GoodRoot, launch 3 consecutive businesses in addition to the 2 that already existed, and then had an opportunity to come on board, and I just couldn't pass it up. It was
I was gonna say, like, that transition, right? And I presume as a consultant, eventually you do such a good job that people want to hire you full time, right? I mean, that seems like a natural transition. So, like, what do those conversations look like, and then how do you sort of make sure that you do, right by your consulting company that led you to this conversation in the first place, right?
Oh yeah, it wasn't easy. I was there for a long time, so it was. In the end, it was about me. Kind of, I said, look, I need to keep learning. So I knew that healthcare was this entirely new industry. I mean, I literally didn't know barely what a deductible was 3 years ago. Yeah. So, but I knew there was a lot of potential based on what I saw and the performance of this leadership team, the things they were interested in, the aspirations they had, and then I knew I could learn a lot and bring a lot. In relation to imagining and reimagining some of these systems and products, and then bringing those things to life.
Well, one of the things you said over coffee, which I really like, and maybe even we'll make the episode title, is reinventing healthcare one system at a time. Because I was expressing to you over coffee, right? I had heard of GoodRoot. Obviously, I featured CoEO and what's the other? AlignRx, right, on an episode specifically last year, and that was a really engaging conversation. But I was stuck in thinking of GoodRoot solely as a pharmacy-based prescription solution. And so when we had our initial conversation maybe a few months back now, it was like, oh, wow, I guess I didn't even realize to ask the question that GoodRoot is a lot of other things. And so why don't we just crystallize real quick, when we say GoodRoot, what do we mean? And then we'll drill down into the business units, but what is it, kind of the overarching company, what does it do?
Yeah, so GoodRoot is a community of companies, as we describe it, but it has a parent organization, which is GoodRoot itself. And that consists of an executive leadership team and what we call amplified services. So it's centralized business functions from legal, marketing, finance, IT, and then we have a national commercial sales team as well.
Okay.
So what happens is, and the concept is, the entrepreneurs who have the ideas to, for a product or to solve a specific solution in healthcare, I'll bring it back to our kind of mission statement of reinventing healthcare one system at a time. Each of our businesses, we have 9 businesses in total now, focus on a specific kind of problem in healthcare or creating a solution in healthcare. And then we're able to help them come in and scale faster. Okay. So with all those business functions, we all talk to one another. We all know one another. Our systems communicate internally. And we all now, a lot of our leadership team they're sort of veterans in healthcare, right? I'm new, and a few of us are new, kind of bringing some of the new perspective, but many of them have been in for 20, 30 years, easy in the pharmacy space on the medical side. So we are all experts in those various fields, so we can provide a lot of executive guidance as well.
Well, that's what is that old adage in sales? You land and expand. Sometimes there's a singular solution a business is looking for immediately to solve for, and then over time you're able to come in and say, well, we can also do this if this is an issue, right? And you expand outwardly from there by having that variability in what you do. That gives you opportunities to solve individual problems.
Yep.
But was there a bigger problem initially, conceptually, that they saw needed to be solved in healthcare?
Yeah, I mean, well, the list is long, right?
It's a litany of, items, but
one of the ones I will focus in on for sure, and this has been crystallized in the last couple of years, is a real focus, and we didn't even speak about this before, on alleviating and eliminating medical debt in the country.
Yeah.
So, as I mentioned, our founder, Mike Waterbury, is just really focused on this from a policy perspective, from a solutions perspective in the commercial side. And it's a big problem. I mean, it's actually the leading cause of bankruptcy in the U.S. And
I think the stat is 60% of 60% of bankruptcies are due to medical debt.
Yep. It's like the average family, I think, is like $2,000 in medical debt plus, even with insurance, with health insurance.
Yeah, 80% of those people had insurance at the time that claim happened, right?
Yep.
That's an astonishingly high percentage of people that are suffering because of medical debt.
So where we're focused from a solutions perspective is, we realize that we have to do this one system at a time. We can't do it sort of holistically. You can't flip something like this. So we're focused on building for the future, but creating really relevant solutions for today.
Okay.
And that spans from our deep history in pharmacy, so pharmaceutical consulting, practice around helping groups lower spend and get better contracts, working with manufacturers to get discounts direct to patients and really simplify drug pricing. We're investing heavily in healthcare navigation with our company Emory, and that spans the gamut from sort of preventative measures and steerage, if you will, to bill review and negotiation, bill accuracy. The example you gave, connecting people with the right programs. Integrated into that is hospital financial assistance, and we've built and we are continuing to build a national platform for hospital financial assistance. Most people don't even know what that is. I didn't before, but...
Well, Nate, there's a really high threshold for qualification too, right? When you think financial assistance, you think people maybe that are living below the poverty level or at least below the average income for a family, right? But realistically, it's multiples of that, correct?
Absolutely, yeah. In Connecticut, where I'm from, I think you can be making $120,000 a year with a household of 3 or 4, and you can still qualify.
Yeah.
So...
And most people think of 120 grand, like 6-figure income. You see all those influencers,
right.
Oh, it makes 6 figures. That's seen as a high income, and it is, right? But realistically, they're still in a situation that financially they may or may not have the means to be able to pay, so they qualify, which is, again, I didn't even realize that was the case.
Yeah. And there's so much opportunity. There's some stigma around it. I think there's some words that are connected to it, like charity care. And look, I don't need charity, but look, these hospitals are nonprofit for a reason. They to maintain that status, they need to give a certain amount of assistance to their community. So that's what this is about. It's about connecting people to that assistance in the easy way. The part of the problem is there's a lot of barriers.
Yeah.
The details around the policies are often hard to find. The application process is fairly complex. So our tool allows people to check for eligibility really quickly and then get through that application process with guides that support any questions or any things that they need.
So how big is the human component to that? I mean, it sounds like the human element of providing, navigation and assurance is a big part, right? It's not seeking to maybe automate humanity out of the equation, or...
For sure.
Okay.
I mean, our Emory is, our care navigation company is really... we say human-driven, tech-enabled. So we're kind of human first. However, we are investing pretty heavily as Empara. So I'll talk about Empara a little bit. In addition to those solutions that I mentioned, Empara, we just launched a year and a half ago, and we are a developer of mission-driven healthcare technology. Kind of makes sense, right, as an extension of Goodroot. But our flagship product is our health engagement platform.
Okay.
So we actually we can deliver our own solutions, and one of the reasons we decided to build this ourselves was to deliver our own kind of custom solutions like hospital financial assistance that I mentioned. Also deeply integrated if buyers want them integrated, or they may have their own care navigation or concierge solution, is Emory. And so that's where you come to the human component.
Right.
And I could talk about some of the features we've built to kind of enable that human component as well. But you mentioned the automation piece.
Yeah.
We are currently in beta testing with our virtual AI assistant named M, and there's sort of a base assistant. But what's interesting about what we're doing is we are having it so you can deploy your own assistant that's fully in context to you as a group, say, for example.
Okay.
So we can feed the model
what type of data?
All of the plan documentation, any written documentation on your add-on solutions, whether that be your virtual care provider, a specialty pharmacy card, whatever it might be, all into this thing. It can be named and branded to your specifications. And really, it's all about that context. And that's what we're really excited about, the potential of this. The future of that will be that we're actually interrogating actual claims data, and we have a data type in Empara that we call our insights, which is done a little bit more manually right now, sort of custom set to you if you were the group. But we're going to be interrogating claims and actually delivering that relevant content to members. I mentioned that earlier around that experience that people expect in other retail markets. When you go to those pages or screens, it's customized to you. It's based on what you last searched for. It's based on your preferences, right? So we want to see the same thing happening in healthcare with our member engagement.
Well, it's almost like your social media feed, right? It's curated towards what do you pay attention to? What do you search for? What do you like?
What are your conditions?
And it's feeding you more of that, right? And then it becomes almost a self-reinforcing feedback loop where it's like, no, I actually want to see something different. You keep feeding me the same stuff. But ultimately, I get the customization component of it.
PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. But what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
Well, I'm just listening to you talk about this and over coffee too. You know, one of the biggest problems I see in self-funding today is that there are so many solutions out there.
Yep.
And one of the things that I think frustrates employers when they go from a transition from fully insured to self-funded is now I have a lot more choice, which sounds great on the surface, but now I have a lot more choice and there's more things that I have to think about. And it seems like every day somebody new is coming to my consultant or coming to me saying I can solve this particular problem. And so when you break it apart and reassemble it like a puzzle, sometimes it's difficult for those early stage employers or consultants that don't do it a lot to go, I don't even know how to reassemble this and make it cohesive for my member. To me, it sounds like that's a big motivation behind Empara, is that connecting, I've heard connective tissue used before, but you're connecting those macro components of a self-funded plan and helping them talk to each other, right?
Yep.
Helping it be a little bit more efficient between those entities.
Yeah, well, it's efficiency and it's usability, and in the end, we need to drive behaviors that improve outcomes and lower costs. So what Empara does and offers is the ability to configure that ecosystem around your groups.
Okay.
Right. So, and you mentioned the sort of point solution fatigue concept.
Yeah.
I mean,
Yeah.
I like to split that in two kind of categories: is how are the buyers or the people responsible for delivering the benefits experiencing that, and then how are the members experiencing that? So on the buyer side, it's like choice paralyzation, right? It's just like there's so much to think about. Paralysis. Yeah, that's what I was looking for. So there's so much to think about, and then there's dangers in it too, where if you swap every different group, or if you kind of swap in and out these different providers, it can cause disruption. So we look at that and we say, okay, it's all about connectivity. It's all about integration. So a lot of the work that we do is on the data side, where we want to streamline eligibility and file sharing between these trading partners. And in some cases, we're actually integrating right with the benefits enrollment system, so that we become sort of a secondary record of truth, and we're passing that along to the different downstream partners in that system. But inside of Empara, you can set up at the group level those partners, those add-on solutions, your particular plan designs, that AI assistant I was talking about, and then all of your custom notices and in-app engagement. So if we didn't touch on it before, we have Empara is delivered as a fully native iOS and Android app, as well as a web app. So and it allows really anyone responsible for delivering a benefit to members to do that in a way that feels more consumer grade. It feels at a higher level.
Well, and how do you drive the member to that? Because I know a lot of app-based solutions struggle with getting people to download it and to use it, right? And so what is the solution for that resistance that they might experience?
Yeah, there's no magic bullet there. I mean, it just, you're looking at old school, member outreach and marketing to some degree. However, we're really thinking about what can we provide in that equation to help to help the success, right? So we're seeing about, I think, 50% utilization currently, we're seeing that climb. So that comes down for us to a real partnership with the consultant that is working inside of that group, the TPA, and the employer themselves, and bringing them into the conversation and bringing them into some of the actions. Going with digital first strategies in some cases, not sending a physical ID card. I know that's sort of controversial in some cases, but
I still get physical ID cards and they end up in my wallet, and it's like usually just this like piece of paper that half the time I lose, or I have to call my wife and say, what's our group number, but it's still part of the process today, even 2024.
Absolutely. And we, and it seems kind of silly because you can take your phone and pay for everything. You can do everything else on your phone. So what we've done is we've actually worked really hard to do some of these basics way better. So we split coverages, and we ingest supplemental coverages as well. So we'll do, major medical and pharmacy, but we break those out. We'll do dental and vision, but we'll break those out on their own cards. You can tap and share and fax and print out your ID card, so you can still go print one if you'd like to. But really, that digital first strategy, we need to reinforce that this is a valuable place to come. You're gonna get, as a member, you're gonna get a lot out of using this technology, and
do you see employers or the associations that you work with incentivizing the members to download it in the first place? Or
yes,
as soon as you log in, you get $5 gift card or whatever it may be?
Yep. I mean, some of it's just the carrot stick thing, right? Some of it's like, you have to do this for your enrollment. You check a box in your system. You can't move on before you've done it. Then there's the incentive piece, right? But also, one of the key things that we found is involving the benefit sponsors and even the HR departments at the employers or groups in that process. So in our system, we have built a robust message center where we can stitch together all of the service providers in that ecosystem around the group and extend logins for them.
Well, give me examples. So the service, a TPA?
TPA could be member services at a TPA, could be the care navigation company. It could be the broker, depending on how involved they are at that level. In some cases, this is wrapping it back to the engagement piece. What we found really cool is that sometimes the HR representatives want to have a topic in there. So the member's just presented with a simple pick list of how I need help with what, right?
Yep.
But what we're doing is we're integrating the HR people into there to answer benefit questions, to answer questions about the company. We're actually ingesting employee handbooks, and either through our AI assistant M or through the HR person, they're able to answer any questions about their benefits, about their complete package.
Yeah.
So by providing that touch point, again, we're kind of training members on this is a valuable place to come. You're going to get a lot out of this, and you're going to get the answers that you need.
Well, and to me, I'm thinking about as you touched on care navigation, but as you think about, let's say a non-emergent situation, so not a situation like I described at the onset of the podcast, but I know I need to go get an image, right? If I were to engage proactively with a solution like you guys provide, I could probably have shopping help, or I have somebody available to answer questions. Hey, these 3 providers in your 2-mile radius, this one's $500, this one's $1,500, quality scores, like all of that proactively is there available if I think ahead of time to use the app instead, right? So I keep thinking about human behavior and sort of reprogramming almost the way that people consume healthcare. That's going to take a while, but if the tool is simple enough to use and the experience, you as a customer or chief experience officer, the experience is good enough, I'm willing to engage proactively, then I have a better outcome. The plan has a better outcome as a result.
Yep.
At least that's the idea, right?
Absolutely. And some of the things that we're doing in there is, again, looking at that claims data. So if we see someone on a certain prescription, we can present them, hey, did you know that there's a cash option that's much more affordable? And here's the card right in the app for you,
really?
In that notice.
Yeah.
It might be a little more complex than that. It might be, if they're on Humira, for example, and we need to kind of engage at a different level, it might be a pharmacy concierge that comes in and sends a message about that and has a conversation about alternatives for drugs. So
are those levels of service baked into the pricing, or are there kind of buy-ups or hourly rates?
Well, the pharmacy concierge piece is a buy-up, but the automation piece is not. So we're trying to get as much in there, and we're trying to work with the consultants and the groups, and depending on who the buyer is, and we can get to that too, but we're trying to work with them to see what are the top things that you're seeing as your trends in spend, and then what can we build around that for you to get people before they get in trouble.
Well, didn't you say you guys test a lot on yourselves first?
Everything.
What is I'm not only what is it? The hair club for men is like I'm also a client. I don't remember these old commercials, man, but it was like, he's also in the hair club himself, right? So he's a client as well. So you guys are testing some of the things on yourself. Are you recognizing the problem exists in your own plan first and then testing it then to deploy it, or are you deploying it and then also using it on yourself simultaneously?
I mean, both. Kind of all the above. Okay. Yeah. I mean, we're pretty aware, and obviously part of the sales conversation is listening, and it's an opportunity for R&D, right? So everything we do, every conversation we have, whether that's with a strategic partner or a potential customer, we're listening for their pain points, and then as quickly as possible, bringing them into our roadmap. Planning to implement. So, and we, like you said, we test everything on ourselves. So we try and work out the kinks and see what works and what doesn't, and then improve from there.
Well, so you mentioned earlier, and I know I wanted to go here now, is kind of who is the audience for this, right? Because I usually think in the broker distribution channel solely, right? That's my lane. But I realize there are other sales channels as well. So when you think of the audience, who would be ultimately buyers of what you provide, who are you talking to?
So the major groups are, and this gets to how flexible we made the platform, because it's pretty adaptable to the needs of these different audiences. So from a sort of almost like a TPA level perspective, there's certainly a prospect for sure. And that
so let's stay on them for a second. What would you do for a TPA?
So that's adopted as more of an enterprise level solution, where they're going to bring that in. They're going to have that as their preferred member engagement tool and solution.
Okay.
We're going to look at their preferred and curated partners for virtual care, whatever. We're going to deeply integrate with them. We're going to figure out all the data, file sharing. In some cases, as I mentioned, we're getting eligibility from the benefit enrollment place, and we're feeding it to the TPA, and in most of the cases, we're getting it from the TPA.
Okay.
So we're going to integrate with them in that way, and then we're going to help them in our system. You can set plan templates. So a lot of times there's kind of a core of 5 to 10 like plans. We'll get those in, and then from there to roll out a group, they just duplicate assign the plan to the group, attach and connect the service providers that are involved in that plan, configured at that level. We ingest any of that member level information. If there's those documents I mentioned, to kind of pull into our AI assistants.
Are you the goal to make them more efficient, or work with
Absolutely.
TPAs that don't have the tech or the
Both.
capability to okay.
Yeah, it's a lot. You know, a lot of TPAs have invested. Some of them have their own whole engineering teams. What we've seen and heard is that there's still disparate systems, and they're looking to consolidate.
Yeah.
They're looking to have it in one platform from a cost and efficiency standpoint. So from that side, we're looking to bring more horsepower, I would say, bring a higher level experience than maybe some of the technologies they've created, and also drive efficiencies. So with the AI assistant piece, you know, we could potentially remove 70 to 80% of call volume for answering really kind of silly questions almost, right? So one of our clients is really excited about that because most of the questions they get are fundamentally
Super
basic.
routine. Yeah.
So we don't want to turn people off with technology and AI assistance to make it impersonal. But in the case where their, you know, member services team is being overloaded with that kind of stuff, it's very meaningful.
So that's the TPA channel. Who else? Who else is a buyer?
So brokers and consultants for sure. And from that side of things, again, we will just be their dedicated partner. I mean, and do as much as we can to create efficiencies in how they enroll groups. In some cases, you know, we'll set up the file feeds with them. We'll take on the ingesting of the plans and setting up eligibility and all those things. We can come with prepackaged sort of messages and notifications and communication materials, all of that sort of pre-done.
Yeah.
We can co-brand things. The app is fully, I didn't mention this before, but it's dynamically branded. So we can very quickly have it go right through the whole theme of the app if there's a broker who kind of wants that competitive advantage. We're talking to one right now who's very interested in kind of deploying their own solution around member engagement. They want that. They want it in relation to their brand recognition. So they're interested in branding the app, which is very easy for us to do, configuring their AI assistant, and then deploying that as a value add to their kind of groups.
It's funny. I just had the thought. I was thinking of Tom Broker, how Tom Broker would brand his app and take a percentage of every single like message that gets sent or something like that. But anyway, sorry, I got kind of off track for a second. The consultant, though, that makes sense. You know, especially I presume there's some smaller agencies that don't have the capacity nor the capital to build systems or buy systems that do one individual thing like you just described. And I think one of the value propositions you described over coffee was that, hey, you could go spend millions and millions of dollars and build this yourself, or here's one that's already at scale pricing that does a lot of things that you probably wouldn't be able to deploy yourself. Here it is, right? That's
right.
A compelling value proposition for somebody that doesn't have the capital to do
Absolutely.
it on their own.
And so much of it has to do with the maintenance and improvement of those technologies.
Yep.
So a lot of people don't really think of that. They're like, oh, I'll get a solution, I'll deploy it, and we're good, right? Well, no. I mean, it's
Software's
ongoing.
evergreen. Yeah.
It's evergreen, and it moves and it evolves. And actually, the thing I would be critical about in some of the technologies and some of the other solutions that are out there is that people paint themselves into a corner sort of accidentally, to the point where the way they've built and deployed their technologies doesn't allow them to improve it. So they're kind of stuck with this, you know, these sort of basics, and they're not able to do some of the more advanced stuff.
Well, I've seen some systems, and I certainly won't say them out loud, where they're built, you know, 10, 15, 20 years ago, and they haven't really evolved. They do the job they originally set out to do, but even if you look at those systems compared to what a new piece of software, they look so antiquated. And it's just, there's something about even like the way that things were designed, your design guy, the way things used to be designed versus how they're designed now. And it just almost feels like I'm using a dinosaur. Even again, if it's effective at doing the thing I need it to do, there's an optical component to that.
Yeah. And optics, you know, beauty as a function for sure. But our UI UX team is really amazing, and as much of it as that this looks good and it's appealing to use, is there's a component of, is it usable?
Is it useful?
Is it usable? Does it is it actually doing the job it needs to do?
Right.
And so that's what we're always evaluating and looking at and building in terms of our roadmap and improvement over time.
Well, so we touched TPA consultant, the associations you work with as well. What are you doing for them? Yeah.
I mean, I would put, this is maybe not right, but like the member associations one's interesting. There's some people out there that are kind of GAs. They're sort of acting a little bit like a plan, pulling together, curating in some ways, pulling together a set number of plans, as one of our clients right now is doing, picking their partners, and then they're going to execute at scale into these different member associations like teachers, municipalities, first responders, those types of audiences. So they're really perfect for us because we can configure this whole thing, and then we can deploy groups at that level very easily.
Well, so no absence, I would say, of possibilities for sales, right? But then one of the things is kind of figuring out the demands of each individual buyer and that persona. And then you're deploying, you said, commercial sales teams that are out there having these conversations ultimately.
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans, and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Talk to me the positioning, though. One of the things like we were having kind of an off-camera conversation about was the positioning of this, right? And over time, how old is GoodRoot? Is it
4 years?
4 years, okay.
Now, I think.
I think over time you sort of hone that positioning, right, and kind of what that solution ultimately does, and kind of speak to that really, if you want to summarize. And then I'd love to talk about just your experience in healthcare, which I, as being a kind of a fresh set of eyes in healthcare. But if you wanted to summarize, if you will, GoodRoot before we move to that, like what would you say there?
For GoodRoot or Empara?
Or Empara. Let's do Empara because I think that was the crux of most of the conversation today.
Empara allows anyone who needs to deploy a benefit to members access to bleeding edge technology at a price that makes sense for their business. And it's highly configurable and custom and amplifies the current solutions that they have in place and even teams and people that they have in place in ways that other solutions don't.
Okay, that's perfect. Well, maybe make that a clip, Nathan, if you'll write that timestamp down. There you go. That was good. Now, I'm curious, so just as kind of zooming out a little bit, you've been in healthcare for 3 years, right? I'm sure it's equally as frustrating and as exciting to be here. But kind of just give me some, whether you got a story or two, just give me some experience because I can imagine I've been in here 15, 16 years now. You get a little jaded, you get frustrated, you try to start every day with hope that we can solve some of these problems, but some of them seem too big to solve. So what's your perspective on all of that?
Yeah, well, when you asked that, it made me flash back to my first day.
Okay.
And the gentleman who hired me sat us all down. We had a couple of us that started at the same time, and we were looking at this big PowerPoint slide. And it's this map of drug pricing and the way that it works.
Yeah.
And I was like, this is absolutely insane. Mm-hmm. So, in some ways that made me like almost giddy because like as a designer, looking at big challenges and trying to solve for them kind of is the fun. It is the job. So, that it didn't discourage me at all. And I think even now being in it, the thing that's most discouraging, if anything, is we talked about this earlier, but like the accountability for the overall experience of healthcare and who takes that on, especially in a sort of a self-funded place, a self-funded plan. Overall, not discouraged. Really excited about everything that we've been working on so far. There's definitely been failure points with some big things that we tried to do with drug pricing, but the way that we work is we just pivot really quickly. So having that commercial team out there, giving that feedback. making really quick decisions, moving teams around if we need to. That's what's so cool about GoodRoot and in all those sort of affiliate companies underneath is we have that connectivity and we can play a little bit like a chessboard. We can, if we need to, we can pivot, we can change something up, we can move a team over here and then refocus them on something else,
Okay.
right?
Yeah. Well, what gives you the most hope, though? I mean,
Yeah.
you said you weren't discouraged, even you saw the convoluted mess that is the pharmacy industry. What gives you hope, right? That you're doing meaningful work.
I think there's a lot of positive change happening. People are creating really cool solutions out there. We see technology as being one of those pillars, if you will. Policy is another one, so we're seeing that play out with fiduciary and everything else. It's a big deal, and I think the pressure there is going to drive change for sure. And then there's that consumer kind of behavior. So the more pressure that's put on employers or groups to take responsibility for the benefits that they're delivering, they're going to have to look at solutions that are going to provide a lot of value. So that's exciting. So I think there's a lot of hope on that side. From a technology perspective, I like to imagine the leapfrog moves. Like right now, I feel so far we've done a really good job kind of leveling up the current experience inside of our health engagement platform, for example. But the things we think about long term are how can we create an experience that's just much, much more simple, where you have a patient or a member that has a healthcare need. They find a provider or a service for that need. They can see how much it costs. They pay for it. End of story.
End of story. Yeah.
So that's where, from a GoodRoot level perspective, we see things going eventually. But again, that one system at a time piece, can't do that overnight.
Well, I look at it like Amazon as a kind of corollary there, right? Amazon started selling books online, right?
Yep.
And now look what Amazon does today. Who doesn't get a package at some point delivered from Amazon? And the shopping experience, they've streamlined that, the ranking systems, the speed at which it shows up at your doorstep, and the efficiencies of all the logistics. I mean, they didn't start out that way. 20 years ago, they were shipping books, okay? So knowing and seeing what they've been able to accomplish, if we could replicate an Amazon-like shopping experience from end to end in healthcare. The problem's big enough to solve. There's $4.5 trillion at stake. The problem's big enough to solve. It may be more complex than selling books online, but it's certainly big enough to solve. And I love the fact that just intelligent people have dedicated their life to try to solve a component of it, a facet of it, right? And so that kind of leads me into the final question with you, Ben. You've been in here 3 years. Where do you see this going? Right? Where do you see the system itself ending up, right? What do you suspect, whether that's hope or fear? Like, where do you think this thing's heading?
I mean, I think that there's going to be a lot more, utilization of cash pay, direct pay solutions. And that's sort of the thing I mentioned before, that more simplified user journey.
Yeah.
We're going to be testing out some of that at GoodRoot, into a reference-based pricing like model, I think, next. There's many who are doing that successfully. There's some of the obvious issues with it, with balanced billing and sort of disruption on the member side. But we really feel like with some of the fundamental underpinnings of the healthcare navigation, surrounding people with that support, and then providing them the right technologies, that we can make it very viable. And then it just comes back to some of the more difficult stuff like underwriting. How do you make that happen if needed, or is it needed depending on the sort of, if you're going with more of a cash pay type situation.
Well, the bottleneck in that situation, and I do agree with you that the closer we can get to a cash or cash-like transaction, the better.
Yep.
And I think the moral argument is there to justify that. But the bottleneck right now is third-party payers, opaque insurance and network agreements, and that disparity between whoever your payer is and what you pay. You're at the mercy of whatever they've contracted, and they won't let you see the contracts, right? So you only know after the fact. It's nonsensical at this point that's still the way that this system functions. And so whether reference-based pricing using Medicare as a proxy or true cash equivalent pricing that you can see ahead of time, that is where it needs to go.
Yep.
And I think that's where it is going. You just have very powerful players that are preventing it from being scaled at the moment.
Sure. Yeah.
That's my soapbox.
Yeah. No, it's a big challenge, but it's exciting, and we're all having a lot of fun working on it. So,
well, Ben, before I forget, I'd be remiss not to say that is a damn fine jacket.
Thank you, sir. Thank you, sir.
And I even felt bad because I told you, I'm like, man, I'm wearing the same jackets. I'm running out. I got to go get some new ones. And so today I just threw on a sweater. I'm like, damn it, you came with like a really nice crushed velvet brown jacket. Like it's a good looking jacket.
I told you, I feel like it's a competition. Who can wear the coolest jacket?
You won, dude. I mean, you obviously won today, and I feel bad about that. But all kudos to you. And, joking aside, you traveled down here from Connecticut, man. And so I definitely appreciate that. I'll let you have 30 seconds if you want, kind of closing thoughts, right? As we summarize, you summarized Empara and Good Root, but kind of closing thoughts of today's conversation, what you want to leave the folks with.
Yeah, I mean, I would just say that consider member experience as a fundamental piece of delivering a benefit, and a lot of the solutions that Good Root is focused on have to do with financial health as a part of overall health. So relieving and eliminating medical debt, integrating solutions if you do have super high deductible health plans or high out-of-pockets, finding ways to surround people with support so that their experience is better. I mean, it needs to be that we fix the mistrust of healthcare from patients and members to engaging them and sort of creating some relearning around. I can go here and get something valuable.
Right.
I can go here and not have a terrible experience where I'm on the phone for hours calling 5 different parties to try and resolve my issue. We need to solve for all of that so that it's more rewarding, more enjoyable, because that's where the cost savings will come in. That's where the innovation will come.
When there's a responsibility too, right? You make that experience better. The individual now, if it's that simple and easy, they have a responsibility to participate. And I think what self-funding does is allows the individual member to understand what role they play in the bigger part of the sponsorship of a health plan from their employer. And so I think the more exposure and awareness that we create and the simplicity that you're talking about makes them better buyers and consumers, but there's an onus on them to be active participants as well. And so I think that's a radical shift in healthcare that I hope we see come to fruition. So, all right, Ben, this has been a great conversation. Really appreciate you coming down, man. Hopefully it was worth your time. And, eventually we'll kind of do a retrospective in a couple, a year or two and have you back if you're willing.
Yeah, no, thanks a lot, man. Appreciate you having me on.